Right now, we're gonna go ahead and talk about dilators. So oftentimes, physical therapists or other providers will recommend that someone work with a dilator. And so many patients tell me they don't know what that is or why they would work with them. So for this video, I'm gonna go ahead and explain who might benefit from working from dilators, but also I'm going to go through some different types of dilators so you can see the options that are out there for you as a patient, or even for suggestions providers can give to their patients. So in another video, I talk about the pelvic floor structure and function and all of those things. Briefly, that pelvic floor is shaped like a bowl. There's 3 layers. They start most superficial and then move internally. So I like to think about the pelvic floor as I go through layers 1, 2, and 3 as if I'm moving up the stem of the wine glass for layers 1 and 2, and then layer 3 I'm falling into the bowl or the glass part of the wine. So when we're thinking about using dilators, because the pelvic floor is not like another group of muscles in our body where there's not a joint where I can stretch or lengthen that muscle, with the dilators, they're going to help to give us that stretch and lengthening. So individuals who might benefit from a dilator include people who have pelvic floor muscle tension, or pelvic floor muscle tension myalgia, which is just a fancy way of saying tension, but also pain within those tense muscles. People who suffer from pain with intercourse. Also, people who have urinary incontinence or constipation. Oftentimes, these muscles are not weak or lengthened, they just are so tight that they don't have the ability to relax and contract. So using a dilator really allows those muscles to find their length and then eventually find their strength as they're supposed to. So I've been talking about dilators. Let me go ahead and show them to you. So we have these variety of sizes for the dilators. I'm going to go ahead and grab another one here, and we'll show you more of this, but just to get a sense, this brand of dilator is very flexible, whereas other dilators come in more of a rigid plastic. For me, the things that I'm thinking of when I'm recommending someone using a dilator is, one, what are they comfortable with? Some people are freaked out by something that's a rigid plastic, whereas other people prefer something that is a little bit more flexible or bendy. So that's one of my first things. And the second thing is cost. Oftentimes, the more flexible or bendable dilators are more expensive, whereas the rigid plastic ones can be a little bit more cost effective. So as a patient and as a provider, really thinking about your comfort level, but also really thinking about the cost, because I certainly don't want someone to feel that they can't be successful with something that I'm giving them to do at home because they can't afford the product that they need to use. So that's one component. The other component is, depending on the type of dilator you're using, you want to make sure you're using the right lubricant. So these dilators here, these flexible ones, are a silicone. So you never use a silicone lubricant with a silicone product. So you're going to want to make sure to use a water-based lubricant. Usually KY, Astroglide, Sliquid. There's a lot of great options that don't have any additives in them, so find the right water-based lubricant that works for you. When you're dealing with the rigid plastic, you can use a water-based, you can use a silicone or a water-silicone hybrid. I find it easiest for people to use a water-based really across the board because that's easier to clean off when you're done. So these dilators can be used within your home on your own. Sometimes I have patients that are very nervous to work with them, so maybe the first few times we do them together and in the office. Now, every physical therapist or provider is different in what they're going to recommend for you to use for applying the dilator. So I'm not really going to speak to that there, but working with a physical therapist who has experience working with dilators is going to be the best, because we want to get that tissue stretch, but we also are working on your brain to say, yes, something can be in the vaginal canal without it being scary or painful. So I love these as a tool because you as a patient can really feel like, hey, I can be successful with this. Not only can I place something in my vaginal canal that is not painful, I'm able to deep breathe. I'm able to find that muscle and body relaxation. And then another thing that I like to layer on with this is, as you work your way up to the goal size dilator, you can start to know, oh, okay, I can place something in my vaginal canal that's not painful, that is also the size of my partner, or maybe the size of my favorite intimacy aid. So those are some things to really think about as you're working with these tools.